After 40, three quiet issues often explain why your energy dips, why your focus feels thin, and why sleep and balance are not what they used to be. The surprise is that none of them live in a gym plan or a diet trend. They live in your hearing network, in the health of your gums, and in the medicine list that sits in your bathroom or by your bedside. When you tune these three, the day feels lighter. Conversation costs less effort. Meals feel calmer. Mornings begin on steadier feet. If this kind of practical care fits you, make sure to subscribe so you receive useful steps in each video you can use right away. You will build a toolkit that protects your independence without asking for perfection. Here is how we will do it. We will treat this episode like a calm problem solving. 3 common midlife complaints will come to the table. For each one, we will follow the trail inside the body, find the real driver, and then fix it with steps you can take today. No drama, no jargon, just the right lever in the right place, so the rest of your habits get easier to keep. Problem number 1 is the fact that social days drain you and noisy rooms blur words. The natural guess is stress or aging. The real driver is often a quiet hearing strain. Hearing is not just sound. It is a stream of signals that the brain must decode, separate from the background, and turn into meaning in real time. At 40, this usually works without much effort in quiet rooms. By mid-40s, it often slips in noise first. You can hear a voice but lose the words. The brain responds by pushing attention harder. That works, but there is a price. By evening, the tank is empty. You miss jokes, and you feel a pull to avoid group settings. Inside the system, sound moves 3 tiny bones in the middle ear and ripples the fluid of the inner ear. Thousands of hair cells sway in that fluid and convert motion into electrical signals. Those signals travel along the hearing nerve to brain regions that extract patterns and meaning. With age, some hair cells wear down. Long hours with headphones or visits to loud venues speed that wear. The brain can compensate for a while by turning attention up. You experience that as fatigue, as lost words in restaurants, and as a quiet wish to sit out the event. The fix begins by restoring cleaner input. If captions have crept into your evenings, if you ask for repeats more often, or if you look at mouths to follow a conversation, put hearing on your calendar now. A hearing check gives a baseline and a plan. Wax can block sound, and a simple removal restores clarity within minutes. If loss is present, modern hearing devices deliver cleaner signals without shouting. Daily use matters because the brain needs steady input to keep the hearing pathways strong. At home, reduce hidden noise during conversation. Turn off the dishwasher. Lower the television. Face the person you are speaking with and keep your hands away from your mouth so words land cleanly. In loud settings, carry simple earplugs. Think of them the way you think of sunglasses. Protection is not about fear. It is about saving hair cells that you cannot replace. A few beliefs slow progress. Missing words only in busy places is not proof that hearing is fine. That is often the first sign of strain because damaged hair cells cannot separate the voice from the background. Hearing devices are not a mark of very old age. They are brain tools that lower listening effort at any age. Earbuds at high volume are not harmless just because they feel normal. Time and dose matter here. Even a little over half volume for long sessions can add up to real wear over months and years. There are a few moments when you should see your doctor quickly. Sudden hearing loss in one ear, new ringing with balance trouble, or ear pain with fever deserve same-day attention. Early treatment protects function. Why this fix works is simple. Clear sound lowers the attention cost of listening. When the brain no longer fights for words, it can spend energy on memory, planning, and humor. You enjoy people again. You go to the place you skipped last month. That connection supports mood and protects thinking as the years pass. As listening becomes easier and your social battery lasts longer, meals start to feel more pleasant too. That shift is the perfect handoff to the next problem we will solve, because the mouth is not a cosmetic side project. It is a daily source of either calm or inflammation. Problem number 2 is your mouth. When the mouth is inflamed, the whole system works harder. Your breath is not as fresh, and your gums bleed when you brush. Most people try to fix this with another mouthwash or a stronger brush. The real driver is often low-grade gum inflammation that spills into the bloodstream all day. The tissues around your teeth are alive with tiny blood vessels and immune cells. When those tissues are calm, the bacterial community in your mouth stays balanced. When they are inflamed, they leak bacteria and chemical messengers into your blood. That steady trickle raises background inflammation, nudges blood vessels to be a little less flexible and a little more sticky, and makes blood sugar harder to manage. If you live with diabetes, you already know how small infections echo through your numbers. Gum inflammation is one of those small fires. The drift begins with a sticky biofilm at the place where tooth meets gum. When brushing is short and the narrow spaces between teeth are not cleaned, that film matures and hardens into tartar. Gums swell. Tiny vessels ooze when you brush. Breath lingers. The immune system arrives every day because that is its job. Those signals do not stay local. They travel through the bloodstream and make vessels less cooperative. You feel this as a day that feels inflamed, even when you slept well and ate reasonably. The fix is not forced. The fix is gentle, thorough care repeated every day. Twice each day, brush for 2 full minutes with a soft bristle brush and a fluoride toothpaste. Move the brush slowly where the tooth meets the gum. Gentle circles clean better than a hard scrub. Once each day, clean between teeth, if floss frustrates you. Use soft interdental brushes sized for your spaces. They should feel snug without pain. If gums bleed, keep going gently for a week. Bleeding is a sign of inflammation, not a sign to stop. It almost always eases as the tissue heals. Time sweets with meals rather than snacking on sugar all day. Your mouth makes more saliva during meals and clears sugar faster. Sip water throughout the day to support saliva. If your mouth is dry from medicines, speak with your clinician about options that reduce dryness and consider sugar-free gum after meals if that is safe for you. Book a dental visit if you are overdue or if bleeding persists. Ask for a clear plan if early gum disease is present and pair it with steady home care. If you live with diabetes, let your dental and medical teams share information so both plans work in the same direction. If you have a heart valve issue or an artificial joint, follow your clinician's instructions before invasive dental work. Common ideas can stall progress. White teeth do not guarantee healthy gums. Early gum disease shows up as tenderness, bleeding with brushing, and breath that lingers. Brushing harder does not clean better. It scrapes soft tissue and wears the tooth surface. Mouthwash does not replace cleaning between teeth. It can freshen breath and lower some bacteria, but it cannot lift the sticky film that hides in narrow spaces. Why this fix works is also simple. Calmer gums mean fewer inflammatory messengers bathing your blood vessels. Healthier vessels handle pressure changes better and are less likely to misbehave. Chewing is more comfortable, which makes higher fiber foods feel inviting, and that supports steadier blood sugar. Healthier mouth bacteria are less likely to spill into the airway during sleep, which lowers pneumonia risk in vulnerable adults. That is a lot of return on 2 minutes twice a day. When the mouth is calm and meals feel easier, energy rises. That is the right moment to look at the third problem, because it hides in plain sight, and it changes how steady and clear the day feels. Problem 3. Your mornings feel foggy. Balance is not as sure as it was, and sleep solves less restful than it used to be. The guess might be age alone. The real driver is often hidden in a routine medicine list. 2 families of drugs raise risk as we age. One family blocks a chemical called acetylcholine, which helps attention, learning, memory, tear and saliva production, bowel movement, and bladder function. The other family sedates the nervous system, which slows reflexes and fragments sleep, even if you do not remember waking. At 40, a nighttime pill can feel helpful. By mid-50s, the same pill can soften reflexes, cloud attention, and raise fall risk without warning. These drugs appear in everyday places. Nighttime sleep aids often rely on older antihistamines with strong anticholinergic effects. Older allergy pills can do the same. Bladder calmers work by blocking acetylcholine in the very tissue that needs it to function. Some gut antispasmodics and some antidepressants carry anticholinergic effects. Muscle relaxants and some medicines taken for anxiety can sedate you well into the next day. Cold and flu products sometimes combine multiple drugs, so you are sedated and anticholinergic at once. Over-the-counter is not a free pass for daily use after midlife. Inside the body, the brain uses acetylcholine to help circuits pay attention and to write new information into memory. When that signal is blocked every day, attention slips and new learning is harder. The bowel depends on that same signal to move. Block it and constipation becomes common. The bladder needs acetylcholine to empty. Block it and urgency and incomplete emptying can both increase. Sedatives add another layer by slowing nerve activity and disturbing the pattern of sleep that restores memory and repairs tissue. The result is a body that moves a little slower and a mind with less room to think quickly, especially under stress. The fix is a calm review, not a sudden stop. Write one complete list of everything you take. Include prescriptions, non-prescription, pills, herbs, and supplements. Include powders, drops, and anything you use only sometimes. Scan the list and mark items that say nighttime, drowsy, or may cause drowsiness. Mark older allergy medicines, any bladder calmer, any muscle relaxant, and any cold product with more than one active drug. Take this list to your clinician or pharmacist and ask for a review that looks specifically at anticholinergic and sedative load. The goal is not to go without help. The goal is a safer plan at the lowest dose that works. If a drug is truly needed, ask about ways to reduce risk. For bladder urgency, pelvic floor training and bladder training often help. For seasonal allergies, newer antihistamines are less sedating. For sleep, protect the last hour of evening, keep the room dark and cool, and let your brain learn a steady landing before you reach for pills. Never stop a drug suddenly without advice, especially those used for sleep or anxiety. Sudden stops can be dangerous. If you take several drugs that affect the brain, avoid driving or using tools until you know how you respond. A few signals deserve same-day attention. Sudden confusion, a new fall, fainting, or severe constipation can be drug effects, not just age. Treat these as reasons to call. You will not be a bother. You will be safer. Why this fix works is clear. Reducing drugs that block acetylcholine can brighten attention and lift energy. Reducing sedation restores reflexes and balance and makes sleep more restorative. Walking, learning, and conversation become easier, which in turn makes your other healthy habits easier to keep. One careful review can change how your week feels, when listening costs less effort, when the mouth is calm, and when medicines are lighter. The three fixes begin to reinforce one another. You return to noisy places without dread. You taste food more fully and chew without soreness. You wake clearer and steadier. At that point, willpower is not the driver. Your systems are working with you. Now, let us stitch this into a routine you can actually live. Pick one starting point today. If social days exhaust you, start with hearing. If your gums bleed or your breath lingers, start with the mouth. If mornings feel heavy and your balance feels off, start with the medicine list. Set a 10-minute reminder and complete the first step before you move on. Small finished steps are stronger than big plans that wait for the perfect day. Your home can make these steps automatic. Keep earplugs in your bag and in your glove box so protection is easy when the room is loud. Place a 2-minute timer by your toothbrush so you give your gums the time they deserve. Keep soft interdental brushes where you will actually reach for them at night. Put a small glass by the sink to cue a rinse after brushing. Move nighttime sedating pills out of easy reach while you and your clinician design a safer plan. Put a hearing check on the same annual list as your vision check. Keep one page that lists your medicines, doses, allergies, diagnoses, surgeries, and clinician phone numbers in your wallet and a photo on your phone. A little order prevents big problems. What progress looks like in 1 to 3 months is practical. Group conversations no longer drain you, and you stay longer because it feels good. There is less pink on your toothbrush, and food tastes brighter. You carry earplugs without thinking. You clean between your teeth most nights because it feels normal. One older allergy pill has been replaced with a less sedating option, and your mornings are clearer. Captions are off more often. Stares feel steadier. You sleep through the night with fewer awakenings and wake with enough fuel for a gentle morning walk. These are the early signs that the slope is changing. There are moments when it is wise to call the same day. Sudden hearing loss in one ear, severe ear pain with fever, a dental infection with swelling or fever, facial swelling, sudden confusion, a new fall, fainting, or a new severe headache deserve urgent care. When you are unsure, call. Getting help early protects you. And there are 2 small upgrades that help once your routine is steady. The first is a 5-minute sound hygiene habit. Before a loud event, decide on ear protection and choose a spot away from speakers or machines. After the event, pick 10 minutes of quiet so hair cells can recover. The second is a 2-minute evening sweep for mouth and medicines. Brush, clean between teeth, sip water, and glance at your 1-page medicine list to remind yourself of the safer plan you already chose. Those minutes add up 2 months of protection. I would like to hear one action you will take in the next 48 hours. In the comments, write a single sentence that names your step and the day you will do it. Will you schedule a hearing check? Will you add a 2-minute interdental clean tonight? Will you circle your nighttime medicines and ask for a review? Your line may be the nudge someone else needs. Before we close, here is a quick recap framed as a decision you can make this week. If social days are exhausting and noisy rooms blur speech, treat hearing as brain care and act now. If your gums bleed or breath lingers, treat gum care as heart and metabolic care and give it 2 minutes morning and night. If mornings feel foggy and balance feels off, treat your medicine list as a dial you can set with your clinician and lighten the drugs that cloud attention and slow reflexes. None of this requires a perfect lifestyle. All of it is grounded in how your body actually works. You can age with clarity, energy, and confidence. Hearing care lowers brain strain and supports connection. Gum care lowers inflammatory noise throughout the body. A lighter medicine load sharpens attention and steadies your step. Each fix is small on a given day. Together, they shift the direction of your health in ways you can feel. If this was helpful, subscribe so you receive more tips that you can use right away. Share one insight in the comments so others can learn from your plan, and share this episode with a friend who wants real tools, not hype. Let us be the group that protects our future selves by caring for the quiet systems that carry us every hour of every day.